How I got into dentistry is kind of an interesting story. I originally thought I wanted to be an engineer, and when I transferred to Georgia Southern, Dr. Sarah Bennett was my advisor, and I was an undeclared major. When I went in for my initial consult, she said, well, we've got to pick a pathway for you. So was there anything at Georgia Tech that you liked? And I said, well, I guess biology was the only thing I really enjoyed. And she said, for now, you're a biology major. And she said, there's 3 pathways with biology. You can either teach, or do research, or go into healthcare. And I said, well, I don't like to teach, don't like to be in a lab, so I guess it's healthcare. She said, you got 3 options. You can go to medical school, you can go to pharmacy school, or you can go to dental school. She said, you know anybody in any of those 3 professions? And I said, well, my uncle's a dentist. And she said, for now, you're a pre-dental major with emphasis in biology. So that's ultimately how I got started on the pathway. It just tended to be a good fit. Gainesville, Hall County is a great place. When I moved here 18 years ago, obviously it was a much smaller area. It's a great place to raise a family. We've gotten involved in the community here, and this is home. There's lots of opportunities to give back to the community in Gainesville, a lot of great nonprofits. Our tagline is, we take care of families in our community. And those families can be our patients' families, our employees' families. We also feel like it's very important to give back to the community. Part of our ministry is to help others that may not have the means to be able to take care of themselves. And whether that's through volunteering at Good News Clinic, helping with the indigent head and neck cancer patients over at Northeast Georgia, all those things give us an opportunity to give back to the community. I think from the moment that you walk in the door at BGW Dental Group, you experience a different feel. Our goal is to put the patient's needs first before what we may need, and whether that's time constraints, we have to work through lunch to see you when you have a problem, or have to have some flexibility in payment options. Our goal is to create an environment that's comfortable for you, and then also frees you up to be able to have the things that you need to have done.